Hello, I'm here to talk today to Susan Douglas from the Douglas Method. Hi, Susan.
Hello, Steve. How are you?
I'm very good. Nice to see you again. So, the Douglas Method. Now, you're Susan Douglas and you've developed the Douglas Method. I love people who can put their names to a product or service. So, tell me a bit about the Douglas Method and how it works.
Okay. So what the Douglas method is I use lots of different interventions. So it's classed as an integrated system. And a lot of people will ask me what is different about what I do. And actually, one of the doctors that I was collaborating with, she actually explained it more clearly. And she said, you don't actually use maybe different interventions like, myofascial release or strength and conditioning, or if I happen to use the ultrasound machine. But what you do have is a complete unique approach to how you analyze why somebody has a particular problem. So I would look at what somebody's problem was. So somebody once said to me, but we know what the root cause is. It's a herniated disc. And I said to them, yes, but I work out why you've had that herniated disc. And when you can work out why somebody has a herniated disc, you can then work out the correct treatment to, one, correct it and also stop reoccurrence. And that's really the grounding of that's how I work.
Yeah, and it's rehabilitation really for a lot of people, aiming for a pain-free existence, a pain-free life.
Yes, in relation to musculoskeletal conditions, I can't advise on other things, but I would possibly, if I thought it was more to do with a diet nutrition basis, I would possibly refer it out. But usually I can help on that as well. But my skill is musculoskeletal. So yes, lots of conditions: osteoporosis, sciatica, herniated discs, frozen shoulder, bursitis. The list's pretty endless.
Quite debilitating for a lot of people, these things like sciatica. A bad case of sciatica can be a horrible thing. Any one of those things can be quite brutal for people, in fact.
It is actually. There's quite a lot of forums where there's literally thousands of people with sciatica, but what's happening is people are looking for a magic exercise. I get asked that a lot. What do I do to get rid of it? And I've said, well, if there was a magic exercise, nobody would have all these problems. There is, however, a magic exercise once you work out why they've got it. So somebody could have sciatica for, let's say they had osteoporosis because of the weakness of the spine caused by osteoporosis. That can cause the pelvis to destabilize. Therefore, that can bring on sciatica. Somebody might be doing a particular sport, maybe doing too much in the gym. They might be overworking a certain muscle group, and that then leads to flinging the pelvis out of alignment, which then leads to sciatica. So once you establish, in conjunction with your patient, and do a full analysis and consultation, then there is a magic exercise or a few magic exercises.
Okay, and you can do in-person consultation, but anything that you do in person, you can also do online. Is that correct?
Yes, I have patients now all over the world: Connecticut, Canada, Texas, France. Just been treating a lady in France. Yep, all over. No difference. The analysis is what really gets to the root of this, but then applying the exact correct interventions to help the patient with their problem.
And would you do that with them in real time, like so one-on-one, like a web meeting where you would
Yeah.
correct or give
Oh
them
yeah,
exercises and
yeah,
make sure
yeah.
they're doing them properly?
Yes, because that's how we can do it online. A lot of people say, "How can you do that? You can't touch me." But of course, it's been established that I don't actually need to touch somebody, because let's say I wanted to do a bit of myofascial release, which is a clinical technique, say on their neck. But what I've done is over time I've developed certain exercises where I actually get the same benefit. So it's a lot about self-help. So I teach you, the patient, how to treat it, because I can't get my hands on you. But I do the same in the house because I'm realising that I don't need to put my hands on something.
Do you think people are in bad habits, and do you think people stick to the program, Susan? Like when you give them it, do you I mean you're quite I say that, I mean this in the nicest way, a firm but fair person. If you gave me instructions, I think I would follow them. You know,
People have said that, Steve. We're
yeah.
petrified not to do it.
Yeah, but that's not a bad thing, you know. I think people have got to say, look, you know, I've got to meet with Susan again next week. I better do this because people can be quite lazy sometimes, and they can, you
Well,
know.
they can be, but as I said to them, you could come here and I could do maybe the release, but you still have to do maybe certain exercises I give you, and that's why I generally only do 3 because I sort it in 3. But I'll say to them there'll be a reason why it doesn't work in 3, and the reasons are: 1, you've not done it, or you've not done it correctly, which is why we have this constant, they can get in touch with me when they want to go over exercises. I don't mind that. And also the other reason is that, let's say somebody has got major damage in their spine. So let's say somebody comes to me and I saw out of the 2 sessions, I'm thinking, oh, something's not happening here. It's generally because there is some major damage, like maybe desiccated discs, which is not anything I can fix. These are operational. Yeah, there's not a lot that are operational. Maybe 0.2% really require operations. A lot of it is very, very treatable. But if it's something like that, then there are other things that we can do to still also avoid operations. Yeah, so say somebody's got a desiccated disc and it would normally require spinal fusion or something like that, then you can use other treatments. So I might use clinical core work, which is not, I hasten to add, what you will see in the gym is clinical work. So I've got to make that quite clear. Yeah, it's not doing a big plank or jumping about with a medicine ball. It's,
Yeah.
it's very, very specific.
And you've
So
got an excellent website there as well, Susan, the douglasmethod.health. I'm just going to put this on the screen just now and have a quick look at this while we're chatting.
yeah,
So it's the douglasmethod.health. So it's the douglasmethod.health, and it's a really nice looking website. You know, you've got everything there: analysis, correction, education. You do one-to-one group classes, and then you've got the Douglas Method online, which is online workshops and membership. So we're going to chat about that as well. But it's quite an in-depth website and there's lots of good information there. Yeah, very good. So I would encourage people to go there and look, the douglasmethod.health. And how does it work then, Susan? What are we looking at? An online course or an online group course? Explain how they work and what the likely cost would be. Because people always talk about the money, Susan, and
yeah.
I know you
So
represent great value for money, but people like to know what it's going to cost.
they do. So consultations are £95, and I always recommend that people do 3. Yeah, because we need to analyse, correct, and stop reoccurrence. I do have sometimes offers on, so sometimes what I might do is if they book the 3, I sometimes let them go for £85 per session. If somebody wants just to do a consultation, they're more than welcome just to do that. That would be 95, and it would entail me telling them what I thought the problem was and how about it. But they wouldn't have my ongoing support over 6 weeks. And they wouldn't have a program written out in complete detail for them. So most people do tend to go for the 3, yeah, and that's how we generally do it. Now, because a lot of people, for whatever reason, don't want to do that, or financial reasons, I've made it more available for people where I've brought in the TDM online. I generally deal with people with joint hypermobility osteoporosis, just to classify it, but I do have people in there with herniated discs, with sciatica, with bursitis, and it works very well because I'm specialist in all of these areas. So they can come into the group, and there's 3 different levels. The first level is £10 a month, not even a coffee a week.
It's very
And
good value, very good
yeah,
value.
and within that, they have 4 sessions, 4 short sessions per week, maybe 10, 15 minutes. I don't have a particular time on it. And we might look at 4 exercises. Then what I'll do is explain what people need to be careful of with these exercises. And then I'll go on to give them detail about levels. So they are based for people that might be in a wheelchair. So I can, because of my my skill set from years ago. I used to lecture in health and fitness as well and train PTs and everything. So I can take an exercise, any exercise, and make it achievable for somebody in a wheelchair. Okay, so the levels are really, really good. So from somebody in a wheelchair up to somebody who's super duper fit. And then we'll have another 2 sessions. One's a lower level, one's a higher. And you get all that for £10 a week and part of a group. So you can talk with the other members.
And that's valuable to them as well, that kind of,
yes,
people in a group tend to take
yes,
things more seriously, and they see progress, and they get a wee group
that's right.
buzz.
And I will, if you want to ask me a question, I will come in and answer it. But if they want really more specific help, that's when they want the select membership group. That one is £25 a month, which is just over a coffee a week, which is pretty good. And in that, they get the sessions. But what they also get is they also get 25% discount on one-to-ones with me. They also are allowed to ask me basically anything, and they will get an answer. So say you were in the group, Steve, and you said, oh, that was great, that session, but I saw something on YouTube, Susan, should I do it? Well, the answer would always be, no, you shouldn't do it, Steve, until I see it. So I might ask you to put a wee video of yourself up, maybe demonstrating it or a picture. I will then address that in next week's session or put a video up in the group. So the benefits are unbelievable. And then you also get the courses free. So there's other courses coming out, so you'll also get courses free. So yeah, it's got a lot of benefits.
And all of that's available on the website at thedouglasmethod.health.
It is, yeah.
Okay, well, listen, Susan, it's an excellent service that you've got. It's the Douglas Method. You've created it yourself. You're solving problems. I've seen from your testimonials that a lot of people are finding the benefit. So well done, you. And thank you very much for your time today. It's been an absolute pleasure.
Yeah, it's been a pleasure talking, and it's just my passion in life to help people, and that's it. So hopefully we'll get